Welcome to Beyond the Scalpel. This is our first podcast of our new show, and I'm Dr. Elie Levine, one of your hosts.
I'm your other host, Dr. Jody Levine from Plastic Surgery and Dermatology of NYC. You can learn more about us at plasticsanddderm.com.
This podcast aims to educate, inform, empower people interested in learning or undergoing aesthetic procedures.
Elie, a plastic surgeon, and I, a dermatologist, not only work together, but we are also married with 5 children. And whenever we go to social events and people find out that Elie's a plastic surgeon and I'm a dermatologist, the entire conversation for the rest of the night is about plastic surgery. So we figured we would start a podcast to discuss all the things people want to hear about.
We have an exciting show, and we'll talk about trends in plastic surgery, but we'll also be visited by Luke Andrews, an outstanding reporter for the Daily Mail, and he will touch on a bunch of things with us that relate to exciting things for 2024.
So the first trend we'll discuss is the fact that more and more people are doing plastic surgery, including young people under 30 who are getting married. More brides and grooms are doing plastic surgery and aesthetics treatments. 64% of members of the American Society of Plastic Surgery report an increase in the number of procedures that brides and grooms under 30 are asking for. So Dr. Elie, tell us about that.
So it's not surprising that we're seeing this. People are, there are a few things that have changed over the years. Many things have changed, but 2 things that relate to this are, number one, social media has to be part of this. The combination of people taking more photos of themselves, seeing themselves in more settings, living in that kind of soundbite moment is definitely a factor here. And the fact that the world has kind of moved towards both men and women undergoing procedures or their appearance mattering. And I see it with my grandparents versus my parents versus us and our kids, is that the amount of interest in fashion and how we look and how we appear and how we present ourselves really does change globally for everyone, which I think is a healthy thing.
Definitely. So tell us, what kind of procedures are you seeing young brides and grooms coming in for?
So I'm seeing, we'll start with kind of the brides. So I'm seeing everything from facial aesthetic work. So facial aesthetic work will range from rhinoplasties in the noses or their chin or things like that. And some of the options are minimally invasive, things that require no downtime at all. And others are procedures that have some downtime. So that kind of factors into when people come in.
Right. Got to start early.
Yeah. And we see this all the time. There's some people that come in and they say, I'm excited, I'm getting married, and this is something that I wanted to address before I get married. It sounds great. Okay, first question we ask is, when's the wedding? Right, because if the wedding is 3 weeks from now, it changes our discussion. If it's 3 months from now, it changes our discussion. If it's a year from now, it changes our discussion. So if someone comes in and says to you, here it is, I'm getting married in a month. Like, What are you telling them?
Well, if they're getting married in a month, I would recommend laser for sure. A month actually is enough time to do laser or filler or Botox. I do not do any work within 2 weeks of the wedding, but a month we can do some laser for photo rejuvenation, get rid of all those sunspots, let your skin glow, reflect light. We can do some filler where needed, and even some gentle tox. I never recommend doing it for the very first time right before your wedding. So it would be great if we had the opportunity to do it 6 months before and then 3 months before, but we can do a little bit. I've seen a lot of my patients who go to you for plastic surgery doing their noses before their weddings, which I think is very interesting. I think they are concerned about the pictures.
Definitely. They're concerned about the pictures, and there's certain things you can Photoshop and you can use certain filters, but at the end of the day, they don't want to have to Photoshop every picture and they don't want to filter everything.
Right.
And a lot of the kind of more action shots, or for sure the videos, there's only so much editing you can do there. And so for me, if you're less than 3 months before a procedure and before the big day, it's a problem. Because you really don't want to kind of cut these things close. When you have more time than that, you have a lot more leeway. And we're talking about facial work. We're talking about noses and chins and things like that. But we're also talking about body contouring. So whether it's breathwork, whether it's a lift, an augment, a reduction, and we'll kind of touch on a lot of these topics because they relate more than just before the big day, body contouring, liposuction, things like that. And that's kind of on the women's side. On the men's side, a lot of these things are pretty similar. Men are also concerned with how their nose looks. Some people are concerned with how their hair looks. If they have thinning hair early on, is it something that they can do something minimally invasive like PRP that we can talk about, or hair transplant? And again, if you're talking about hair transplant, you really want a full year at least to really get the maximal effects of it.
Let me ask you a question.
Yeah.
How close to the wedding would you do liposuction? Because that can definitely make a difference in how you look in your gown.
So there are two parts to that. If you're looking at how you look in the gown, if you do it 3 months before, you will definitely see improvement on the big day. Will you see the full effects of it? Absolutely not, but you will definitely see significant improvement. If the answer is, if the question is, how am I going to, will I look my best in my wedding gown, but I also want to really look good in my bathing suit when I'm sitting, on the beach on my honeymoon.
Right.
3 months is on the tight side because you'll see improvement, but may not look as good as you want to look. You're probably looking at more like 6 months for that.
Okay, so explain that to us, because I would imagine if you take out fat, it's gone and you look amazing. Is it the swelling that's still there 3 months later, or is it that the skin needs to tighten down? Why will they look better in 6
Hit
months?
the nail on the head. I had this discussion with 5 different patients this morning. Is that to me, there are 2 aspects to liposuction. There's a reduction of volume, and that's the part that everyone kind of knows. And then there's a second component, which I think is far more important, and that is what's happening with the skin after you reduce that volume. And traditional liposuction, there's minimal amount of skin tightening with it. And then there are other, once you start entering the energy-based modalities, you get dramatic improvement with it. The problem with it is that you begin to start seeing that skin tightening at about 6 weeks out, and it really tightens down for a full 2 years. It doesn't mean you have to do this procedure 2 years before the big day.
Right.
But you look better at 3 months than you did at a month. You look better at 6 months, and et cetera. And so if you can give yourself at least 6 months, ideally 6 to 8 months before the wedding, you're going to look spectacular. Not just good, not just great, but spectacular.
Okay. Now you're referring to your type of liposuction where you do traditional as well as energy-based.
Absolutely. And the recovery is the same. The incisions are basically insignificant and they're the same. The real big difference besides the outcome, the procedure takes a little bit longer from my standpoint. And that's where one of the things that people don't, I don't think they fully appreciate it, is that I can do much more involved procedures that are much bigger with bigger incisions and bigger recovery, say a tummy tuck, that I can do, and I'm not a fast surgeon. It's not where I really want to rush through. It takes me 2 to 2.5 hours to do a tummy tuck, but it can take me 3 to 4 hours to do liposuction and energy-based tightening because it's just so much more detail and time that needs to go into it and patience that needs to go into it.
Yes. Well, you are a perfectionist. So on the topic of more plastic surgery in general, I think it's not just brides and grooms. We all nationally are doing more plastic surgery. There's a 19% increase since 2019. And we are talking about it more. So one of the topics that I have seen mentioned a lot now in the media is the menopause makeover. And I was hoping you can tell our audience about the menopause makeover. These are not really 2 terms we see together a lot.
I don't know who coined it. Whoever it is, it's brilliant because it really is. It's taking the mommy makeover and taking it one step further. And it really isn't. It's kind of, in some ways, it's reinventing the wheel because it's the same thing as a mommy makeover with a slight kind of twist to it. So how is it the same? It's the same because you're addressing multiple things that have changed in women who have, through its combination of, normal aging, weight changes, weight fluctuations, pregnancies, things like that. And so you're talking about everything from breast work to body work being tummies, backsides, waist, everything else like that. And you're adding in one additional nuance. So the additional nuance is the menopause factor. So some of those things is like, it's not unusual for me to have a 35 to 40-year-old patient come in and say, I'm done having kids. I want to take care of my body. And the first question I ask is, how old is your youngest? If they're like under the age of 5, the next question is, how much help do you have at home? How much support can you have for about 2 weeks after a procedure? And if the answer is minimal, then my recommendation is to come back in 3 to 5 years when they have a little bit more help or when the children are a little bit older and a little more independent, because that way they can kind of recover better and get a better outcome. And the problem is that at that point, you're kind of, maybe if it's not the 35 to 40-year-old, or if they're coming in at 43 and they just had a child a year or 2 before, then we're really heading into that menopause makeover. The other factor is that, women get this. Men don't get this. And the issue is that our metabolism slows down as we age. We put on weight more easily. We lose weight more. It's much more of a challenge. But the real difference is that women redistribute weight along their trunk, along their midline, their belly, their waistline, and issues like that. And I have many people that come in that say, I weigh what I weighed when I was 20 years old, but my body's not the same.
Yes.
And that's where the menopause factor comes in.
Definitely.
So
those hormones change the distribution of fat.
And it's like you're integrating maybe a tummy tuck, but also liposuction of the waistline because of that. Now, I imagine there's so many other things that I don't really see that are also coming into play when we talk about the menopause makeup.
Definitely. The lack of estrogen definitely dries out the skin and thins the skin. We definitely need to add some filler. Also, as we get older and we are more weight conscious, if we lose weight in our body, like you said, people tend to distribute weight in different places, so they're more conscious of losing weight, but then you lose weight in your face and your face begins to look drawn. Which it does over time anyway, from losing fat, losing muscle, losing bone, and also the elasticity of the skin getting weaker. So fillers come into play, lasers. There's definitely a lot needed during menopause, as well as good topical skincare using peptides, retinoids, growth factors. There's so much we need to do. Most importantly, moisturization. Sunblock is always important. Yes, definitely. Now, another trend, to finish up our trends,
Yes.
is I have noticed, and you have mentioned it to me as well, that people are asking for smaller breast sizes. First of all, yes.
Can we backtrack just for a sec? Because you hit on such a great point.
Okay.
Because it reminded me that there's one other element to the menopause makeover that probably is different than the mommy makeover.
Okay.
And to your point, they're losing volume in their face. They're losing some of their shine. Things that you don't really talk about so much in the mommy makeover, but is a major factor in the menopause makeover. And that's where things like fat transfer come into play.
Fat transfer. I forgot about that.
So that menopause makeover patient may not need, even remotely need a facelift at this point. At the same time, they notice their face does not look like what it looked like a decade before.
Right.
And there are kind of two elements to that. One is their neck. They may develop a little bit of laxity, a little bit of submental fat, where energy-based tightening, something like radio frequency-based tightening and face tight of the neck, in addition to a little bit of liposuction, will really help shape their face.
Yeah.
And taking fat that we may have taken out of their waistline and volumizing their face has a significant, long-lasting lifting effect. And the thing that most people don't really know is that there are growth factors in that fat. We're not at the point where we can isolate it, but we know it's there and we see it. And we see it not only because they're volumized, but their skin shines afterwards.
Yeah, fat is the best filler and it's beautiful for the skin.
Yeah, and what I see is after they undergo laser treatments by you and they get that shine from that fat, they look,
yes.
They look younger, but it's more they look healthier.
Yes.
They look happier. And so that's probably one of the other elements of the mommy makeover that comes into play separate from the mommy makeover.
Right.
Now, trends with
well, what you were saying reminds me of your new technique, the LevineLift, which is your new facelift, where you also fat.
Yes.
I mean, the skin is glowing. In old facelifts, or when other doctors refer facelifts to me, the patient's skin is tighter, but they still need a lot of work on their skin to make it glow, to make it bright, to make it look younger. I do lasers, of course, and filler, but with your new LevineLift, the skin looks beautiful after the facelift.
Thank you.
Well done. Okay, so the other trend that I was going to ask you about is the size of breasts and this increase in breast reductions that we are seeing.
Yeah, so it's you're seeing it across the country. If you talk to providers and colleagues of mine from all over the country, there's no question it's a global trend. I will say that in general in New York City, part of that trend has already been there in the sense that women that are coming in for breast augmentation, the vast majority of the people that I'm seeing are coming in wanting conservative augmentations. They want to either kind of undo what some of their pregnancies have done, or they want to volumize a little bit. They're not looking to necessarily become adult entertainers. They're not looking to have, people stare at them as they come in the room. They just want to have a little bit more confidence in how they look in and out of clothing, in a bathing suit, not need to necessarily wear as much padding and things like that.
Right.
And so that is a trend that we've seen in New York, but you're seeing it across the country as well. The other aspect is, they talk about breast reductions are increasing, and there are kind of two elements. And if you really kind of break down the numbers, there's actual breast reduction numbers have gone up.
Right.
And then there is people downsizing, where they came in saying that, I used to have 400 milliliter implant and I want something smaller. And sometimes it's very straightforward, switching them out for something smaller. And sometimes it's undergoing a combination of a lift at the same time, easy enough to do, can be done typically in one operation. a pretty seamless recovery, and that's a big factor. I think a lot of it's education when you talk about the true breast reductions. I just
agree.
think that like the people know so much more about it and they come in so better informed.
Yes.
I think there's also a lot more comfort talking about it. So in the past, a lot of people would undergo plastic surgery and almost keep it to themselves, not because it was a stigma, but there was almost a sense of almost wanting to keep it private.
Yes.
And now there's almost a sense of like, I want to empower other people.
Right.
I want to help other people in their journey.
Definitely.
And it makes it easier for people to kind of take that leap and proceed with it, and the level of satisfaction. You see it within 24 hours of surgery. That's what's so remarkable.
Yes, actually, the exact statistics are that over the last 4 years, there has been an increase of 54% in breast reductions. That's a lot.
That is a lot.
And I think it's because it applies to every age group, like you said. Even teenagers feel comfortable talking to their parents about it now.
Yes.
And older people who in the past may have said, what do I care about my body, are now realizing they should care about their bodies and their self-confidence. So, and their backs.
I'd like to welcome Luke Andrews to the Beyond the Scalpel. Welcome. Luke currently works for the Daily Mail and has worked in media and with multiple publications throughout the UK as well as internationally. And we are lucky to have him with us today.
Yes, welcome, Luke.
Hello, thanks for having me on.
So we would love to hear definitely what you have to say about trends in plastic surgery, but specifically two of your recent articles. One of them was about the fact that spouses and even parents are gifting plastic surgery to their loved ones. Tell us about that.
Oh, that was so interesting. So we're talking about sort of stories we could do for Christmas. We had the idea of doing kind of, are people giving each other the gifts of plastic surgery for Christmas? We went around and it turned out that was very much the case. There was a lot of interest in kind of getting gift cards as well. Mostly couples was kind of the impression I got, but also people getting it for friends as well, definitely.
Right, and I think Botox, fillers, and liposuction were sort of the three biggies, right?
Mm-hmm.
Did it ever create like infighting between people? Because it's like, you know, Jody's perfect. I couldn't point out anything wrong with her.
Exactly.
So does it ever get awkward where it's like, here are some Botox for you? You really need that.
Well, why do we think that this is okay now to gift your loved one plastic surgery? What's your impression? What has changed in society that has now become okay?
So I kind of feel like there's sort of a loss of stigma around it. I think initially people were very much like, oh no, I wouldn't do that, and you know, that's something only for celebrities and so on. But I think over time, sort of as more and more stories have come out about it, more and more celebrities have been doing it. It sort of has become more, I want to say normalized almost. Is that the kind of
Yeah,
it's
I
becoming
agree.
much more, you know, it's not like people go, oh my goodness, now it's much more like people are very interested and they want to hear about it, want to hear about the procedure and why someone chose to do it.
Right.
Did you hear about anyone gifting that for Valentine's Day? Because that could be a little more dangerous.
Right. Yeah. I mean, I think it's great. I think it shows that people feel more open with their loved ones, because the bottom line is people have been wanting this for a long time. It's just now they feel more comfortable discussing it. So what kinds of people do you think are more likely than others to gift this as a gift to their loved ones? Or does it just apply to everyone?
Can I say older couples? Is that acceptable?
Older. That's a good point. Yeah.
There's a comfort level there.
There's definitely a comfort level there. Yes. Yes. I think if my daughter's boyfriend told her that he is going to gift her plastic surgery, I'm not sure she'd take that very well.
Yeah, it wouldn't as well.
Yeah. I got the feeling as well from talking to plastic surgeons that there was definitely a barrier there. So like, although someone may get you that gift, they'd then sit down and have, you know, a whole chat with you to make sure that this was actually something that you wanted to do, rather than kind of just something that you know, your partner wanted you to do. It's something that you wanted and they've gifted.
Right.
Yeah, I think there was, I don't know, you know, it doesn't come up that commonly, but I think that there is the fear amongst the American Society of Plastic Surgery where I gift Jody a procedure and then Jody goes to see the plastic surgeon and they're like, this isn't the right procedure for you. And then you have this kind of weird dynamic of, gee, we already paid for a procedure that's not the right procedure for you. And so obviously you could be refunded and all of that, but it is an interesting phenomenon that you might think that
Right.
procedure A is the right procedure for you, but it might not be.
Right. That is a very good point. Another story that you covered, which I find very interesting and that you actually interviewed Dr. Elie for, is this trend of men wanting to reshape their nipples, like David Beckham.
Yes.
Tell
Yeah,
us
that was very
that.
interesting.
Why do you think that has become a trend?
Um, my understanding of it, from thanks for your help on this story. My understanding of it was more a case of people are much more fitness conscious, much more body conscious. Sorry, much more fitness conscious, I'm going to say. And they're more often in the gym wearing very tight fitting clothes. And if they
Yes.
have a sort of slightly more, a man has a more prominent nipple, then it will show through the fitness top, and they might want that changed. That seems to be the reason. And also kind of just from watching David Beckham on the pitch and really liking his nipple shape as well.
Hilarious.
It's interesting because we were just visiting our daughter who's abroad in Australia. And even though, it's heading into the fall there, their fall at this point is quite nice and warm. And people are really fit and exercising all the time.
Oh my God, so fit. Everyone is jogging all day long.
All day long. And while they should be covering up and using sunblock, I would say we saw a large number of men running, well, mostly men running topless, wearing without their shirt on.
Yes, it was killing me. No one wears sunblock in Australia. What is wrong with them?
But
I saw the same in Philadelphia when I was there.
Yes. The other thing that I think is happening more now that clothing styles are getting tighter is liposuction a little bit on the male breast. Correct?
Yeah. So, the idea of what, gynecomastia or man boobs used to be like procedure that someone who had a really large chest would consider doing surgery. And now people come in and, they don't have a bad chest. And I'm upfront with them. It's not like I look at them and if someone did have a bad chest, I wouldn't say a bad chest. But if they don't have one, I point out that like, this isn't necessarily a must do. And they're like, no, I really care about what I look like if I'm wearing something tight fitting or a knit.
Right.
And like you said, it's a nuance factor where I want to go from not just very good, but I want to go from very good to outstanding.
Honestly, I get it. When you wear a very tight shirt and you see your chest, it's different than when the styles were more, loose.
And it also, harkens back to what we were speaking about a little bit earlier, is that 30 years ago, people were talking about plastic surgery in women and a tiny bit in men. And now it really is so mainstream and so across the board. It's like anyone and everyone is paying attention to these topics and paying attention to how they look both in and out of clothing.
Right. That's true. So tell us, are there any other really interesting plastic surgery stories you have covered? Give us something we don't know.
Ooh. I was really interested just sort of by the figures showing the way in which sort of plastic surgery has become more common in the US, how the number of surgeries carried out. I think the latest year the data is available 2022, and it keeps hitting record levels all the time. And so it's really interesting sort of showing how more people are coming forward, becoming more accepted, more mainstream part of treatment of, things people have.
What we're seeing now is there's a lot of weight loss going on, especially with Ozempic and all the other pharmaceuticals that are similar. And that is prompting a lot of plastic surgery because as people lose weight, their skin is loosening up and the necks especially, right, Dr. Elie?
Yeah, so the neck is a big factor, volume in your face, whether it's with fillers or with fat transfer, things like that. And it's also one of those things where there's almost a sense when people weren't where they wanted to be physically, where it's not, they just kind of gave up on everything.
Right.
And then they lost a little bit of weight and they're more fit and they, overall their body's better, but they want even more perfection. And some of those things can be accomplished with further weight loss and exercise. And some of them require, something procedural. And so they're more inclined to do it because they're like, I'm really close to being where I want to be. If I do this, I'll get to that point.
Right. It's a very good point. I think once you start doing something for yourself and you like the results, it gets you interested in doing more, which actually makes me think of liposuction. Sometimes when patients lose weight in preparation for liposuction, and then you do liposuction, it makes them want to maintain that body, right?
Yeah, if you talk to a lot of people after they've done liposuction, and I see these patients out for just to make sure that everything is where we want it to be for well over a year out, they'll describe to me that while they ordinarily had significant weight fluctuations, they've been stable or lost a little bit more, well past the year. And some of it may be physiologic, but a lot of it's confidence.
Definitely. Well, Luke, we really appreciate you being on the show with us. Thank you.
Yes.
Is there anything else about plastic surgery trends you would like to share?
I wanted to share a personal anecdote, if that's all right.
Absolutely.
Yeah, cheers. So I want to talk more about kind of how plastic surgery become more accessible from my own perspective. So I know for me personally, like, I would never have considered getting anything because I always thought, oh, but maybe this will change how I look further down the line. And maybe it won't be like my authentic self almost. And then I was talking to my partner, and they said like, "Oh, I've had something done," and I had no idea. I'd never realized before, but that was like, a completely eye-opening experience. They had like injections into their face, some sort of to enhance the collagen in here or something to get it to grow to kind of look a bit younger. But like, I'm sure there's lots of other people out there having a similar experience of like, oh, and then that sort of very much really opened my eyes and made me think, oh, maybe this is something that
Interesting.
that makes sense.
Did that change your impression of your partner? Did you think less or more of them?
No. More of them for like, yeah, for mentioning it.
Good point.
You hit on such a key point because one of the, social media is great. It gets a lot of information out there. It's so informative. It's helpful. One of the things I don't like about it is that there's such a sense of some, well-known stars out there who want to kind of present this image of, I did this all myself, or I'm naturally like this. And there's nothing wrong with someone who's naturally great at things. That's great. But the bottom line is a lot of these things aren't natural. And it's almost unfair to people that aren't where they want to be to like look at that and say, oh, if only I was born like so-and-so. The answer is no, they weren't born like that either.
No, it's true.
They've embraced it and they've had success with it. There's nothing wrong with you considering it. And it changes perspective.
And the other thing is sometimes it's just a minor tweak that could make such a big difference, right? So sometimes people have a little bump in their nose and you put a little bit of filler, a dab right under that bump, and it disappears. And it's not surgery, there's no downtime, and it's a little nothing that now makes such a difference.
Yeah.
It's almost like wearing
makeup. My nose.
That's awesome. Thank you so much for sharing that. I love personal.
No, not at all.
Definitely.
So thank you so much for coming. We hopefully will have you back. We'd love to have you back. And can't wait to see what other amazing topics you're going to be covering in the coming months. Okay, everyone. So this concludes our first edition of Beyond the Scalpel. To learn more, visit us at www.plasticsanddurham.com.
Thanks, and we will see you back here next time.